We'll start with some symptoms. And this is not an all-inclusive list, but many people that struggle with hypothyroidism, so if you're not even sure, but maybe you're struggling with some of these symptoms, this might be, again, paying attention, this might be something that you want to, after watching tonight's show, go and ask your doctor or talk with your doctor about it. So one of the biggest ones is low energy. So people with low energy or fatigue. Now, a lot of things can cause fatigue, so I don't want to scare anyone into thinking they have thyroid if they're struggling with low energy or fatigue, but this is a hallmark classic symptom. And this could be, low energy even after a full night's sleep. So you're getting plenty and ample rest, but you're still tired. You don't have your get up and go. Exercise wears you out or wipes you out. So low energy, fatigue. We also see with low thyroid, we see hair loss. Now, not the same kind of hair loss as autoimmune hair loss, where we might see big nummular patches of hair loss as in alopecia areata, but in essence, we'll see clumps of hair coming out. So basically, clumps of hair, bigger losses of hair, hair thinning are all part of low thyroid function. We'll also see dry skin. And again, some people naturally have a tendency toward dry skin. If you're that kind of person, you may not have thyroid disease, but if your skin has always been relatively okay and then all of a sudden it starts getting really dry, you're losing hair, you're really tired, okay, this trifecta of symptoms is something you really want to pay attention to. Low libido. Sex drive is dramatically reduced when somebody's thyroid hormone is not functioning properly. So if you're struggling with low libido, this is another one. Constipation. Very common because low thyroid slows down bowel function, slows down the motility of the GI tract itself. So constipation is a symptom. Joint pain, and we'll include in this, kind of have it down here, muscle tightness and stiffness. But remember that your muscle, pound for pound, it's one of the most energy-using organ systems or systems in your body. And when your thyroid is low, your muscles get tight, they get stiff, your joints get compressed, and you can start developing pain. So it's very, very common. And then we have this weight loss, weight gain. So which is it, right? So some people actually gain weight when their metabolism slows down. They put on extra weight. They don't know where it's coming from. They're not eating more. They're trying to exercise, but the weight still keeps coming on. And some people with hypothyroidism actually start to lose weight. So it's kind of, most people are focused on this weight gain, and doctors particularly are focused on weight gain. So if you're one of those that really struggles to keep the weight on, that doesn't disclude you from the potential that your thyroid might be malfunctioning. And then in addition, gut dysfunction. So we mentioned constipation, but it's also very common for people with thyroid issues to develop IBS, irritable bowel symptoms, irritable bowel syndrome. So gut dysfunction can be quite common in those with a low thyroid as well. So if you struggle with this conglomeration, so again, remember, these are all symptoms potentially of low thyroid. Okay, we're not talking about hyperthyroid. If we're talking about hyperthyroid, we would say bulging eyes. Is a condition known as exophthalmia. If you haven't heard of that before, let's change our text color here so you can see it better. But exophthalmia, which is when the eyelids bulge out. Heart palpitations. So again, some of you watching may not be struggling with hypo, you may be struggling with hyper. Okay, exophthalmia, heart palpitations, difficult sleeping, you can't go to bed at night, jumpy or restless legs. We'll see hot flashes that can mimic menopausal-like symptoms. We'll see severe mood swings and irritability, shortness in your temper. Okay, we mentioned that, mood swings, shortness in your temper. So these are super classic symptoms of hyperthyroid, heart racing or elevated heart rate, weight loss, not weight gain with hyper. So generally this is you can't keep the weight on. So the weight's falling off of you and you don't know why. So again, the difference here, these are symptoms of a low thyroid. Okay, these are symptoms of a hyperthyroid situation. And several reasons why I bring this up. We're talking about thyroid disease. You know, there's autoimmune thyroid disease, it's called Graves'. And then there's autoimmune thyroid disease called Hashimoto's. And they're both autoimmune. And many people don't realize that autoimmune disease has the same underlying core fundamental causes, right? So whether you have Graves' or whether you have Hashimoto's, what I'm telling you tonight, what I'm teaching you tonight applies to both scenarios. So I get the questions a lot. What about Graves'? Because we've done a lot of education on Hashimoto's in the past, but people come back and ask, what about Graves'? What about Graves'? Pay attention, because everything I'm talking about tonight also applies to Graves'. Now it also applies to medicine induced. So sometimes what happens is the meds you're taking for thyroid are too strong. The dose is too high. And so sometimes these symptoms are also a conglomeration of your medicine dose being too strong. And so keep that in mind, because if you've been medicated and you're being medicated for your thyroid and your dose just got changed, and then you start struggling with some of these types of symptoms, then that's your cue to call your doctor and make sure that he's on the same page with you, that you're not being over medicated. So now, interestingly enough, heart palpitations are also a symptom of low thyroid. So this one could be on both sides of the equation, but the rest of these are pretty much predominantly hyperthyroidism. So again, those are your symptoms that you want to look out for and you want to be aware of. I want to talk about a couple of studies published on thyroid. So this first one, you can see here the importance of nutritional factors and dietary management of Hashimoto's thyroiditis. This was published in 2020, and so you can see this was a review. So in literature, there's evidence for, again, we're talking about nutrients here: selenium, potassium, iodine, copper, magnesium, zinc, iron, vitamin A, vitamin C, vitamin D, and B. Okay. The role of the proper level of protein intake, dietary fiber, and unsaturated fatty acids, especially omega-3, has been indicated. And we're talking about hypothyroidism, but also we're talking about hyperthyroidism, because these nutrients, and I'll show you in just a minute where these nutrients fit in, but they're important and they're critical for the normal regulation of thyroid hormone metabolism. So in this case here, HT stands for Hashimoto's thyroiditis. Patients should often eliminate lactose because of intolerance and interactions with levothyroxine. So this is something we didn't mention a minute ago. Let's change our color again. Levothyroxine often has dairy in it, lactose. Levothyroxine also has corn in it. So those of you trying to follow a true gluten-free diet and not realizing that, and maybe you're taking your levothyroxine, you're getting exposure to corn gluten on a daily basis, which can also interfere with your overcoming of a thyroid problem, but dairy as well. Again, this study, because of intolerance and interactions with levothyroxine, and gluten because of possible interactions of gluten with thyroid antigen. So we know that gluten, we know that dairy can both be contributing factors, and we know all these nutrient deficiencies can also play a major role in the development of thyroid disease. So let's shrink this back down and let's blow this one up so you can see this better. Okay, so what we've got here, multiple nutritional factors in the risk of Hashimoto's thyroiditis. Conclusions: clinicians should check patients' iron, particularly in menstruating women. Why menstruating women? Because when you're menstruating, you lose iron once a month. And so with that loss of blood. And so when you lose that iron, there's this transition. It's like a 1 to 10 day period. And I don't mean period as in cycle, but period as in period of time, where your body's trying to recover that lost blood for recovery. And so what happens to women is they spend a third of every month, up to a third of every month, just in iron deficiency recovery, which is impacting the way their bodies can properly produce T3, which is the active form of thyroid hormone. But again, iron in menstruating women and vitamin D status to correct any deficiency. Adequate selenium intake is vital in areas of iodine deficiency and in regions of low selenium intake. Okay, so again, more research. This is another review study published in 2017 talking about nutrition as being very, very critical in the metabolism, the proper metabolism of thyroid hormones. Hey, don't forget to check out the rest of the series right here. Make sure you hit subscribe below. And as always, thanks for tuning in.